wonderful model system for how the brain processes sensory information. Again, these systems allow us to obtain information about a world outside of ourselves. And so these are the two main sensory systems in human beings. Our cortex will ultimately form percepts that allow us to have a subjective experience of seeing and hearing. Now, in contrast to the auditory and visual systems, our somatosensory system is a specific system which is going to convey information that the brain is going to use to form percepts that are related to touch and other sensations which are within the distance of our body, and also information about our bodies themselves. So we're going to have pathways that are going to transmit information in the somatosensory system that are going to allow us to know about the internal and external state of our bodies. And it is this somatosensory system that we want to turn to now. Just like the auditory system, we aren't as interested in every detail about the system. What we want to do is to be able to generally understand how this system works, and also to be able to contrast it and what we know and what we've learned about the visual and the auditory systems. Now, the other way that we're going to sort of pare down the amount of information in this lecture, because this too is a very complicated system, is that we're going to restrict our discussion to the body below the neck. So it turns out that sensory information from the face is even more complicated, and so we're just going to be talking basically about the body. Again, to review, the visual and auditory systems inform our brain about an external world at a distance. The somatosensory system provides information to our brain about our own bodies and also about the world within touching distance. And we'll see later that this will be very important because different parts of this can be lost with different brain lesions. Just as with vision and audition, we are also going to have different kinds of experiences associated with this. So basically our somatosensory system is going to give us information that our brain will form percepts about that allow us to feel pain and temperature, touch, and proprioception. So proprioception is an especially interesting one that I'm very interested in. Proprioception is about how we know where our limbs are at. Now, this is the kind of thing that we all take for granted. Well, I know where my limbs are at because they're there. But that's not true. You know where your limbs are at because your brain interprets the input that comes in from the limbs. And it tells you where they are at. And believe me, this can be lost in a patient where an individual with their eyes closed will no longer know where their legs are at. So this is very important. So let's define proprioception. Well, proprioception comes in two varieties. You can have a static proprioception where you know where your limbs are at, that even when I don't look at my arm, my brain tells me where my arm is at even though the arm is not moving. And you also have a different type of proprioception, which is called dynamic, which means that now my brain knows where my arm is at different points because it's interpreting the dynamic information that's coming in from the joint. So even something as simple as knowing where your limbs are in space is actually a construction of the brain. And combined with other information, for example, from the visual system, our brain is going to form another kind of percept that is related to the system. And that is, our brain is going to form a percept about personal space, immediate extrapersonal space, and space at a distance. And we're going to learn that the brain is going to process this very differently. It's also the system that provides us with feedback about our body state. And we all know what it means to not feel good or something. This is part of the system that plays a role in this. Now, there are differences between the visual and auditory system and the somatosensory system. And there are differences which turn out, at least for scientists, to be very significant. For the first thing is very obvious. In the auditory and the visual systems, we saw that the receptor cells were located in one place. So, for example, for the visual system, the photoreceptors, which are the cells that are specifically specialized to absorb light, were found in the retina, in the eye, in one place. For the auditory system, the hair cells were found in the organ of corte and the cochlea, all in one place again. Now for the somatosensory system, we're going to see that our receptors are located all over our body and inside as well. And so this is a much more complicated system because the receptors are not in one place. We're going to learn that there are many receptor subtypes as well. The other thing which is different, which we haven't really figured out why, is that in the auditory and visual systems, neurons were spontaneously active, so that the code for signaling in those two systems was to either increase or to decrease firing rate. Neurons in the somatosensory system are not spontaneously active. They fire or they don't fire, so they use a slightly different code. Nonetheless, the code is still that electrical signal between neurons, electrochemical transmission. Now, in the somatosensory system, we have different types of sensations. Basically, what we have are different qualities of sensation of the stimulation of our bodies. So, what are those different qualities due to? Well, we have pain and temperature, touch, proprioception. Those different qualities are due to different types of receptors being stimulated. So we're going to find out that different kinds of receptors are localized in the body that ultimately result with our subjective experience, which is different between pain and touch, or between proprioception and temperature. So those different qualities are actually going to involve different receptors. Also, the pathways which carry the information from these different types of receptors are going to be independent, more independent than we saw in the visual and auditory systems. And finally, ultimately, the reason why we feel one thing as pain and another thing as touch is because our brain is going to interpret what's coming in via the different pathways and receptors in a different way. Let's take one example. One example. Our experience of pain basically results from the stimulation of only a few types of receptors, one of which is called a free nerve ending that exists in the skin. It's a very specific type of receptor. It sends that information along a very specific pathway in the brain, and our brain interprets that as pain. Now, pain and temperature are known as the nociceptive senses. And that means that these are the pathways which transmit information to the brain about potentially damaging stimulation to the body. So these are very old and very important systems. Our sense of discriminative touch, on the other hand, and by that I mean fine touch. So it's not just that you've been touched, but that you understand the quality of the touch. So fine discriminative touch is a high acuity system. And this is the system that's used for our brains to interpret so that we can appreciate the size, shape, and texture of objects. So, for example, this fine system is what allows me to tell the difference in texture between this podium and the skin on my face, which feels completely different to me, and any other texture that we might touch. Now, this results from the stimulation of an entirely different receptor, and these receptors are called Meissner's corpuscles, and they're a very specific type of receptor, and they're concentrated in the tips of the fingers, the soles of the feet, and the external genitalia. So these are part of a system that are exquisitely sensitive to touch. And they're the system that allows us to make these fine discriminations. They're also very popular with most of my students. when they're asked to judge what receptor they think is most important. Other types of receptors underlie other submodalities depending on their location in the body. Now remember, let's imagine that we have a receptor that responds to two different things, but the information is going to travel in different pathways. Ergo, the areas of the brain that are going to interpret know what pathway it's come from, so it doesn't make any difference. So, for example, there is one touch receptor called a Pacinian corpuscle. And this is exactly what it looks like. It looks like an onion, and it has multiple layers. And what happens is when it's depressed, it sets off an action potential in a process which would be located here in the structure at another level. It turns out that the same type of receptor can be used as a touch receptor or a proprioceptor depending on where it's at in the body. So, for example, Pacinian corpuscles in the skin respond to this pressure change in the skin, and my brain interprets that as touch. But Pacinian corpuscles in my joint tell my brain about proprioception because my brain interprets it that way. And again, the brain doesn't care that the same receptor is being used for two very different kinds of information, because this information from the Pacinian corpuscles in these two systems will be carried in separate parallel pathways to the brain, and the cortex is the place where it will interpret whether or not this came from a Pacinian corpuscle in the skin and its touch, or whether it came from a proprioceptor in the joint. So again, we see, like we did with the other sensory systems, information is obtained by stimulation of receptors, and information about different submodalities is going to be kept separate and travel to the brain in separate parallel pathways. So all of the individual information is never going to be lost. And this is just like what we saw with the visual system, where we saw that form, color, and motion were kept separate, so that up here we could have different percepts. So our subjective experience is different of those three qualities. Now we're going to see that it's our brain that tells us whether something is painful or pleasurable. It will be the brain that does this. Now, these different pathways. These different pathways have also evolved, obviously, in the brain and in different animals. For example, it's very easy to understand that pain is a very old pathway in this somatosensory system. One of the most important things that any animal would need to know is if something was nibbling at its foot or something was biting it, if there was damage to some part of its body surface. So this is a very old system, and the information comes in from the part of the body. These specific receptors are stimulated. The information comes into the spinal cord, obviously, because information coming in from the body will come into the spinal cord, and in this old system, a synapse will be made there. And then another neuron will project up to the brain to allow for a conscious appreciation of pain. Now, discriminative touch, notice, is about this fine texture, this high acuity part of the somatosensory system. That's a phylogenetically newer pathway, and it's carried by a separate pathway in the brain that, in fact, the information comes in and travels in the spinal cord without synapsing in the spinal cord. So these are separate parallel pathways, and they can be studied in a variety of animals depending on the evolution of that animal's nervous system. Now, we're not concerned here with like the names of these various pathways and everything, or even where they travel in the brain. What we want to appreciate is that information from these different systems is going in these parallel pathways, which allows us to have different experiences depending on how our brain interprets the information coming in from those pathways. So each of the pathways comes in, and they will cross or not cross or whatever. But ultimately, I want you to think about this. Ultimately, It is this side of the brain that will process the information from this side of the body, and this side of the brain that will process information coming in from this side of the body, or feel what comes in from this side of the body. So it means that ultimately, because things cross in different places, information that comes on this side of the body needs to get to this side of the brain, and that should make sense to you. And at this point in the class, I'll bet you can guess where in the brain all of these pathways are going to first project for us to have conscious appreciation. Yes, they're going to project to the thalamus. So the information that comes in via these independent pathways have their own synapses along the way and different places they cross. But ultimately, they want to get to the cortex so that we have a conscious appreciation of our bodies. And so this information is going to go to the thalamus. In the thalamus, information is going to synapse in a specific nucleus, just like we saw with the other sensory systems. So in vision, information went to the lateral geniculate. In the auditory system, information went to the medial geniculate. And now, for the somatosensory system, all of these separate pathways will converge on a structure called the nucleus lateralis dorsalis, the ventral posterior nucleus, which is a division of the thalamus. For below the body, it's the lateral division, and this is where that somatosensory information will project. Now, in the thalamus, I'll bet you can also realize or guess that all of the information about these various subsystems is still being kept separate. So it's not at the level of the thalamus that percepts are made, so that information still has to be kept separate. Now, given what we've talked about with the visual system, with the auditory system, can you guess where VPL, where this nucleus is going to project? Yes, is going to project to the primary somatosensory cortex. So the primary somatosensory cortex, if you remember, here is Brodmann's map, and you have a central sulcus of Rolando, and primary somatosensory cortex, which is Brodmann's areas 3, 1, and 2, is immediately caudal to that central sulcus of Rolando. And there is a projection here on the lateral surface, and 3, 1, and 2 can also be seen on the medial surface of the brain. Just like in the other systems, primary somatosensory cortex is going to then project to higher order somatosensory areas that are nearby. And it's these higher order somatosensory areas which are going to start forming the percepts which we experience as pain and temperature and touch and proprioception. And we saw exactly the same thing in the visual and auditory systems. The projection is first to the primary area, and then from there to the higher order sensory areas that form the percepts. Now, just like there were retinotopic maps or visiotopic maps for the visual system and tonotopic maps for the auditory system, what we have in the somatosensory system is a map of the body. So we're going to actually have a map of the body surface. A map is going to be an image, a map of the body surface will exist in this primary somatosensory cortex. Now, this map is generally referred to as a homunculus, and that means like a little man image. And this has a real history. Back when it was believed that there was a minute body that could be seen in sperm, and it comes from that historical tradition. So I didn't like it as much, so I had the drawing made so that my body is represented in somatosensory cortex, but nonetheless, what you see, this is the medial division of the cortex, and this is the lateral portion of somatosensory cortex. And what you see is there's an orderly projection of the body surface. Here's my face, the upper limb, and the lower limb. You also notice that just like in the other systems, there's distortion of the map. So in the visual system, what you saw is that what was most important was the fovea, and so we had a disproportionate amount of neural space devoted to processing that information. The auditory system is sounds from speech, and for human beings, it's the area of the face and surrounding the lips because we are very sensitive around the lips and also tips of our fingers, palms of the hand. And so these are the areas of highest acuity, so to speak. And so our map onto our primary somatosensory cortex looks like this because that's the most neural tissue that is devoted to just the processing of those areas because that's our high acuity system, discriminative touch. Now, we think of vision audition about is how we get information about a world that's external to us. Our somatosensory system is going to be important for giving us a different type of information because it gives us information about our bodies. I wanted to use just two brief examples to illustrate the importance of the somatosensory system, though, because we always think of vision and audition as being so dominant in us. And it's true that for information at a distance, these are the systems that we predominantly use. But nonetheless, the somatosensory system is extremely important in human beings. So the first example I'd like to give is for pain. Pain is important for all mammals. Pain, again, is a nociceptive sense. It tells us about potentially damaging information. Now, pain is also different from any of the other sensory systems and submodalities. Pain is our exception to the rule. You can't have a rule unless you have an exception. Exception to the rule, and that is for pain to be felt, you don't need a projection to the cortex. You can actually feel pain at the level of the thalamus. Now, let me tell you the consequence of that. We don't understand this syndrome, but this is very important. Pain is handled differently. It's an old system. We can feel it at the level of the thalamus. There's a disorder in which individuals have strokes that involve that ventral posterior nucleus. Now, let's predict what you think you'd see. All of the sub-pathways project to that nucleus. So indeed, individuals lose all somatosensory feeling on the contralateral one half of the body, just like you'd expect. So pain, temperature, touch, and proprioception are gone. But now a syndrome happens that isn't seen for any of the other sensory systems. When the ventral posterior nucleus is affected, the person continues to not be able to feel touch and proprioception, but pain actually comes back. So within a few weeks, pain comes back, but it's different. Now, anything that touches in any way the contralateral half of the body induces a horrible burning pain. And I've actually had patients brought to my class who had to wear specific diaphanous clothes on one half of their body because even any kind of touch just set off this horrible emotional reaction to the pain that they felt. This is the only system in which you see something like that. And this is because somehow pain is dealt with different from all of the other sensory qualities of information. Now, for us to know exactly where painful information is taking place or where pain is taking place on our body surface, if we have a normal brain and normal projections, we need the cortex for some very fine discriminations. But just to feel pain, we don't, in fact, need the cortex. We only need our thalamus. Again, pain is different in another way. Unlike other submodalities, we do have mechanisms that prevent damage to our receptors, but unlike other submodalities in the pain system, we actually have a way to stop the information from ever getting to the brain. And these are descending pathways which go from the cortex and other nuclei that are deeper and go down to the spinal cord and actually gate the transmission of painful information. This is probably the basis for the placebo effect. When you think you've taken something that's going to relieve pain, even if you actually didn't, but you feel a relief of pain, somehow your brain has set this system into place. This is also the system that's probably responsible for the fact that a soldier can be horribly injured, yet carry their buddy for medical help before they feel any pain or realize that they have been injured very badly. Now, pain is very important in human beings, even at a subconscious level. And we often don't think about this, but it's important to us even when there is no conscious appreciation. So, for example, those of you sitting down and listening to this course, as you're listening to the course, you're making very subtle, small movements. And you're doing that because at points of pressure on your body where you might cut off the blood supply to some part of the skin, there's a subconscious appreciation in your brain of pain, and it causes you to make these little movements. Bed sores form at points of pressure in individuals who aren't receiving this information. So, for example, the elderly, pain thresholds are changed. They often get bed sores. An individual who has spinal cord injury and is not getting information coming up to tell them, they don't get the information, they get bed sores. An infection by bed sores is a major cause of death in individuals who have spinal cord injury. They have to constantly be moved. But the person's not getting any sensory input, say a quadriplegic is getting no sensory input at all from the body, so they don't feel anything. So they don't know they have an infection. They can't report to someone. So they have to constantly be moved to prevent these bed sores at these points of pressure. And finally, in humans, pain has a different type of component to it, which is very important. And that is, it has an emotional component. And we think when something is very painful, we have this emotional response to it. Part of it is to move, for example, if I were to touch this and it's very hot, to move my hand away very quickly. But in fact, in the brain with a correct brain lesion, you can dissociate the emotional aspect of pain from the feeling itself. And we learned this from all those individuals who, at the turn of the last century, had prefrontal lobotomies. So a prefrontal lobotomy is the removal of a cortical lobe. In this case, they removed the prefrontal cortex of the lobe. Or you can do a leucotomy, which is undercutting of the axons which go to the area. So you remember back when we were talking about Egypt, how they used to go up through the nose and pull the brain out? Well, you can go up through the nose and do brain surgery, and you can run a wire back and forth like this and cut the frontal lobes off from the rest of the brain. This surgery was done in a variety of different types of patients, but one of the groups of patients were people that had intractable pain. So these were people that were in such terrible pain that medication could no longer relieve it. When they did the prefrontal lobotomies or leucotomies, it seemed as though these people weren't in pain anymore. And then, lo and behold, a physician asked the right question. He asked the individual, "Do you still feel the pain?" And the person said, "I feel it just like I always did. I just don't care anymore." The emotional component of the painful experience had been dissociated from the feeling of the pain itself, because the emotional elaboration, which is that response, is a cortical function, and the front part of the cortex has been cut off from the rest of the brain. Now, my last example is that our somatosensory system is organized differently in different animals. And it turns out that one of the best studied of all these systems is going to be animals that actually use their whiskers as somatosensory organs. So this is an image of a cat I had a number of years ago named Poupette. And cats use their whiskers as a somatosensory organ to help them in the world and to gain information about the world. This has been best studied in rodents. Rodents can run along a wall in the dark and get along perfectly fine without being able to see very well. And so what we've discovered is that in their cortex, a huge amount of the cortex is devoted to an analysis of the deflection of each and every single whisker. So in human beings, what's most important is fine touch, discriminative touch. And what's most important for Poupette was the deflection of each of these whiskers. I would also like to recommend that you read an article that I have listed at the end of the outlines. And this is Thomas Nagel's famous, often quoted article on what is it like to be a bat. This article talks about how different animals are going to have a different subjective experience. And there is no way that we can ever know what it means to be another animal because our brains are organized differently. I highly recommend it. Thank you.